A Civil War surgeon wasn't trying to save a man's life, at least not in the way we imagine today. His first goal was to outrun death, not the bullet, not the shattered bone, but something far more mysterious, something no one could see, no one could smell, and almost no one even believed existed. A wounded soldier could survive the musket ball that ripped through his leg. He could survive the agony of an amputation performed with nothing more than chloroform, raw determination, and remarkable speed. Yet days later, he might suddenly develop a burning fever. The skin around the wound would swell until it looked stretched tight. Redness crept outward. Thick yellow pus collected beneath dirty bandages. A sweet, sickening odor drifted through crowded hospital tents, where flies moved freely from one patient to the next. The operation had gone exactly as planned, but the real danger had only begun. That strange contradiction defined Civil War medicine. Thousands of surgeons became astonishingly skilled at removing shattered limbs. Many could complete an amputation in less than 10 minutes, not because they were careless, but because every additional minute increased blood loss and the risk of shock. Contemporary surgical manuals and records from the U.S. Army Medical Department consistently emphasized speed as one of the surgeon's greatest advantages. And yet, after finishing one operation, the very same surgeon often reached for the same bone saw, the same knife, the same forceps, still coated with blood from the previous patient. Not because he ignored cleanliness, because he believed the blood itself posed little danger. To a modern audience, that sounds impossible. How could educated physicians fail to wash the instruments they were using to cut through flesh and bone? The answer begins with one uncomfortable fact. During most of the American Civil War, the scientific revolution that would eventually transform surgery had not yet reached everyday medical practice. Although physicians understood anatomy remarkably well and had developed increasingly effective methods of anesthesia using ether and chloroform, the idea that microscopic organisms caused infection had not been widely accepted. Many doctors instead blamed bad air, foul odors, or an imbalance within the patient's own body. The invisible enemy simply had no place in their understanding of disease. Historical records from the U.S. Army Medical Museum and later analyses by historians such as Shauna Devine show that Civil War surgeons were often working with the best medical knowledge available to them, not recklessly, but within the limits of 19th century science. They were confronting injuries unlike anything American medicine had previously experienced, treating massive numbers of casualties under relentless pressure, with little time, limited supplies, and theories that would soon prove tragically incomplete. The blood staining a surgeon's apron could even be seen as a sign of experience rather than contamination. But there was one horrifying consequence that almost no one recognized. Every patient carried something invisible onto the operating table. And with every unwashed instrument, that unseen passenger could begin its journey to the next wounded soldier. The first thing many wounded soldiers noticed was not the pain. It was the noise. Outside the hospital tent came the distant rumble of artillery, the cries of stretcher bearers, and the constant stream of wagons delivering more casualties. Inside, another sound dominated the room. The steady rhythm of surgeons calling for instruments, assistants moving between tables, and the unmistakable scrape of steel against bone. There was no silence in a Civil War field hospital, only urgency. Rows of injured men lay shoulder to shoulder on blankets or rough wooden cots. Fresh blood soaked into the ground faster than it could be covered with straw. The air carried the mixed smells of sweat, damp canvas, tobacco smoke, disinfectants that did little against infection, and the metallic scent of fresh wounds. During warm weather, flies gathered almost immediately, settling on exposed flesh before attendants could wave them away. For many soldiers, reaching the hospital alive was only the beginning. A Minier ball rarely passed cleanly through the body. Designed to expand as it traveled, It struck with enormous force, crushing muscle and splintering bone into dozens of sharp fragments. Instead of leaving a simple fracture, it often transformed an arm or leg into a mass of shattered tissue impossible to repair with the orthopedic knowledge of the time. Surgeons faced a grim calculation. If broken bone remained inside the wound, infection almost always followed. Attempting to save the limb could mean losing the patient. As a result, amputation became one of the most common major operations of the war. According to records compiled in the medical and surgical history of the War of the Rebellion, tens of thousands of amputations were performed, and outcomes were generally better when surgery occurred soon after injury, rather than after infection had already taken hold. The operation itself moved with astonishing efficiency. An assistant administered chloroform by soaking a cloth or folded cone and holding it over the patient's nose and mouth. Contrary to popular myth, many Civil War amputations were not performed on fully conscious soldiers. By the early 1860s, anesthesia had become a standard practice in both Union and Confederate hospitals whenever supplies allowed. Historians estimate that the vast majority of major operations used either chloroform or ether, sparing countless men from unimaginable suffering. Once unconsciousness was achieved, there was no time to waste. The surgeon made broad, confident cuts through skin and muscle. Assistants pulled tissue aside with hooks. Blood vessels were tied off using silk ligatures. Then came the bone saw. Its coarse teeth bit into exposed bone with a harsh, grinding sound that witnesses never forgot. Fine white dust mixed with dark blood as each stroke shortened the shattered limb. Within moments, the damaged arm or leg was gone. The same saw was wiped clean with a cloth, sometimes rinsed in plain water, rarely anything more. To the surgical team, the instrument appeared ready for the next patient. After all, if no visible dirt remained, what danger could possibly be left behind? That assumption felt entirely reasonable under the medical theories of the day. Yet every hurried operation left behind something no cloth could remove. Tiny living organisms, unknown to science and practical medicine, could remain on blades, forceps, and saws, invisible to every eye in the tent. The surgeons believed they had finished the operation. In reality, another procedure had already begun, one that no one in the room even knew was happening. The operation was over. The bleeding had stopped. The bandages were wrapped tightly around the fresh stump. For a brief moment, it looked as though the soldier had survived. Then the fever arrived. It often began quietly. A man who had spoken confidently with the surgeon that morning might complain of chills by evening. His skin became hot to the touch, yet he shivered beneath his blanket. His pulse raced. The wound, which had seemed clean only a day before, began to swell. Soon, the bandages no longer hid what was happening underneath. When they were removed, thick yellow or green pus could pour from the incision. The surrounding flesh turned deep red before fading into shades of purple, gray, or black. The skin tightened as pressure built beneath it. A sickly sweet odor filled the ward, an odor so distinctive that experienced surgeons immediately recognized something had gone terribly wrong. Today, we understand these as classic signs of severe bacterial infection. But Civil War surgeons did not. Many believed that the pus itself was part of the body's natural healing process. In fact, 19th century physicians often described laudable pus as evidence that a wound was progressing normally. The distinction between healthy recovery and life-threatening infection remained frustratingly unclear because the true cause was invisible. The patient, meanwhile, was slipping further away. As bacteria multiplied inside damaged tissue, the immune system launched an overwhelming response. Fever climbed higher. Dehydration set in. Confusion replaced conversation. Some soldiers became restless and delirious, calling for family members hundreds of miles away. Others simply grew weaker until they could no longer lift their heads. Then came the complication every surgeon feared: hospital gangrene. Unlike ordinary wound infections, hospital gangrene spread with terrifying speed through crowded military hospitals. Flesh around the wound seemed to dissolve. Healthy tissue transformed into soft, gray, foul-smelling material that could be lifted away with almost no resistance. The edges of the wound appeared eaten away, exposing deeper muscle and sometimes bone. The smell lingered in entire wards. Modern historians believe hospital gangrene was not a single disease, but a devastating combination of aggressive bacterial infections flourishing in overcrowded hospitals, where contaminated dressings, reused instruments, and poor sanitation allowed microorganisms to pass easily from patient to patient. Research published in medical history journals and analyses by the National Museum of Civil War Medicine point to these conditions as ideal environments for deadly infections long before bacteria themselves were understood. The tragedy was cruelly ironic. Surgeons worked tirelessly to remove shattered limbs before they could kill the patient. Yet with every reused knife, every blood-stained forceps, and every unsterilized bone saw, they could unknowingly carry microscopic organisms from one wounded man directly into another. No malice, no negligence. Simply a scientific mystery that had not yet been solved. Some physicians noticed unsettling patterns. Certain hospital wards seemed cursed. Patients recovering well would suddenly decline after being moved. Entire groups developed similar infections, despite suffering completely different injuries. Doctors scrubbed floors, opened windows, burned foul-smelling materials, and improved ventilation because they believed poisonous air was responsible. Occasionally, these measures reduced infection, not because the bad air had disappeared, but because cleaner surroundings also happened to reduce bacterial contamination, a benefit they could observe without understanding the true reason. There was only one problem. Even as evidence quietly accumulated, most surgeons still lacked the one idea that could explain everything. Far across the Atlantic, a handful of scientists were beginning to question centuries of medical belief. Their discoveries would eventually revolutionize surgery. But for thousands of wounded Civil War soldiers, that revolution would arrive too late. The breakthrough did not begin on a battlefield. It began under a microscope. While Civil War surgeons fought desperately against wounds they could see, a growing number of European scientists were becoming fascinated by something invisible. Tiny living organisms appeared in fermenting wine, spoiled food, and decaying organic matter. Most physicians dismissed these observations as curiosities with little connection to human disease. But one French chemist refused to let the mystery go. Louis Pasteur was studying why wine and beer spoiled when he demonstrated that microorganisms were responsible for fermentation, not spontaneous chemical reactions. During the 1860s, his experiments steadily undermined the long-held belief that life, and by extension disease, simply arose from decay itself. Although Pasteur was not studying battlefield wounds, his work laid the scientific foundation for an entirely new understanding of infection. The implications were enormous. If microscopic organisms could sour wine, could they also invade an open wound? Most Civil War surgeons never had the opportunity to apply that question. The war ended in 1865, before germ theory gained widespread acceptance in medical practice. The lessons emerging from European laboratories traveled slowly, and changing deeply rooted medical beliefs was even slower. Then another physician made a remarkable connection. Inspired by Pasteur's research, the Scottish surgeon Joseph Lister wondered whether surgical infections were caused by those same invisible organisms. Instead of accepting infection as an unavoidable consequence of surgery, he searched for a way to prevent microorganisms from entering wounds. His answer was surprisingly simple: carbolic acid. Beginning in 1865, Lister introduced carbolic acid to clean wounds dressings, and surgical instruments. He even developed a spray intended to disinfect the air around the operating table, believing it might destroy harmful microbes before they reached the patient. While later medicine abandoned the spray itself, the underlying principle that microorganisms caused infection and could be controlled through antiseptic practice proved revolutionary. Published reports in The Lancet showed dramatic reductions in post-operative infections among Lister's patients. At first, many surgeons remained skeptical. Some found the procedures tedious. Others doubted that invisible organisms could be responsible for such devastating illnesses. Old habits were difficult to abandon. After all, generations of respected physicians had built successful careers without ever sterilizing a bone saw. Yet the evidence became harder to ignore. Hospitals that adopted antiseptic techniques began reporting fewer cases of gangrene, fewer fatal wound infections, and significantly better surgical outcomes. Operations that had once been considered extraordinarily dangerous gradually became safer, not because surgeons suddenly became more skilled with the knife, but because they finally understood the enemy they had been fighting all along. Even so, the transformation was not immediate. Antisepsis eventually evolved into aseptic surgery, where preventing contamination became just as important as treating it. Instruments were sterilized with heat, hands were scrubbed meticulously, surgical gowns, gloves, sterile drapes, and carefully prepared operating rooms became standard only after decades of continued scientific progress. Many of these practices matured well into the late 19th and early 20th centuries. Looking back, the contrast is almost impossible to comprehend. A Civil War surgeon could perform a technically flawless amputation. The patient's greatest threat often arrived afterward, carried on the very instruments meant to save him. There was one final lesson still to be learned. The suffering endured in those overcrowded field hospitals would leave a legacy far greater than the war itself, one that continues every time a modern surgeon opens a sterile instrument tray. The greatest legacy of the Civil War was not a new weapon. It was a new understanding of survival. Every overcrowded hospital tent, every exhausted surgeon, and every soldier who succumbed to infection became part of an enormous, painful lesson that medicine could never afford to forget. The war exposed a truth that had always been there. A surgeon could perform every visible step correctly and still lose the patient to an invisible enemy. That realization would reshape surgery forever. As germ theory gained acceptance in the decades after the Civil War, hospitals around the world slowly abandoned practices that had once seemed perfectly reasonable. Instruments were no longer simply wiped clean between operations. They were sterilized with steam or boiling water. Dressings became sterile. Surgeons scrubbed their hands before touching a patient. Operating rooms were designed to reduce contamination rather than merely provide space to work. Each change seemed small. Together, they transformed medicine. Today, an orthopedic surgeon may use a power saw that resembles its 19th century ancestor in purpose, but almost nothing else is the same. Every instrument is sterilized before use. Surgical teams wear gloves, masks, gowns, and eye protection. The patient's skin is disinfected. Antibiotics stand ready to stop infections that once claimed countless lives. Airflow in many operating rooms is carefully controlled to reduce airborne contamination. None of these precautions exist by accident. They are the direct descendants of lessons purchased at an unimaginable human cost. Historians estimate that disease claimed roughly twice as many Civil War lives as combat itself. While not every death resulted from surgical infection, wartime medical records make one fact painfully clear. Infection was among the greatest enemies facing wounded soldiers. The medical and surgical history of the War of the Rebellion, together with decades of research by military medical historians and institutions such as the National Museum of Civil War Medicine, reveals how these experiences accelerated reforms that influenced both military and civilian healthcare for generations. Perhaps the most tragic part is this: the surgeons themselves were rarely the villains. Many worked until they collapsed from exhaustion. They operated through the night under dim lantern light. They improvised with limited supplies, while hundreds of wounded men waited outside the tent. By the standards of their own era, they were often compassionate, highly trained professionals doing everything they believed could save a life. Their greatest mistake was not a lack of courage, it was a lack of knowledge. They could not fight an enemy they did not know existed. That is why the blood-stained bone saw has become such a powerful symbol in medical history. It reminds us that progress is not measured only by faster operations or better instruments. Sometimes the most important discovery is recognizing that the greatest danger cannot be seen at all. The next time you walk into a modern hospital, you will probably notice very little about the sterile packaging, the disinfected surfaces, or the careful ritual of preparing an operating room. And that's exactly the point. Those routines feel ordinary because generations of physicians learned, often through heartbreaking experience, that cleanliness is not a matter of appearance. It is one of the most powerful medical treatments ever discovered. The Civil War left behind countless stories of courage and sacrifice, but hidden beneath them is another story. One written not by victories on the battlefield, but by the quiet revolution that transformed surgery from a desperate race against infection into one of humanity's greatest scientific achievements. If stories like this remind you how extraordinary modern medicine truly is, and how much was learned through history's hardest lessons, consider subscribing so you won't miss the next forgotten chapter of medical history. And if one moment in this story surprised you the most, share it in the comments. Sometimes the smallest forgotten detail reveals the biggest truth about the past.